Right, so this is part 2 of CT anatomy. Disclaimer, it's quite long, so hold your horses. Alright, so let's talk CSF spaces. So, as we all know, the brain is suspended in this clear watery fluid, the CSF or cerebrospinal fluid, which protects it from mechanical distortions. So, it's kind of like the fetus within the amniotic fluid. Well, Orbs has ravished my brain quite lately and not in a delightful way. I had to get it out somehow. Right, so moving on. So the brain is surrounded by CSF, which is harbored within the subarachnoid space. And remember that the subarachnoid space dips into the sulci. So the CSF occupies the interhemispheric fissures, and the sulci outside the brain, and within it is the ventricular system, which circulates the CSF all through the brain. So because CSF also has this additional nutritive function. So it is produced within the choroid plexus of the lateral ventricle and the third ventricle, but predominantly the lateral ventricle. So the route it follows would be from the lateral ventricle to the third ventricle, and through the aqueduct of Sylvius, it reaches the fourth ventricle, from where it flows into the basal cisterns and thence into the subarachnoid space. And from the subarachnoid space, we have the arachnoid granulations occupying the roof of the cranial cavity, which reabsorbs the cerebrospinal fluid and returns it to the circulatory system. CSF being watery, it's almost clear water if any of you have seen CSF, and so it is very, very less dense. So compared to the gray matter and the white matter, the CSF is going to appear much, much darker. So this portion right here and this back here is the lateral ventricle. So if you remember from anatomy, the lateral ventricle is kind of arched, and as we take a transverse section, a portion of it will not be seen. So let me draw that. So assume it's like an arch. So if I were to take a transverse section, you would not see part of the lateral ventricle. So you're seeing the anterior end and the posterior end, but not the middle right here in this particular section. So this particular section shows almost bits of all the ventricles. So this here is the lateral ventricles, the anterior portion, and these two bits back here are the posterior limbs of the lateral ventricle. Then this small part over here is the third ventricle, and back here is the fourth ventricle. So let me switch that color, it's not quite evident. Yes, so this is the fourth ventricle. In this particular image, you can visualize almost the entirety of the lateral ventricle. So you can see almost the whole of it. In between is possibly the septum pellucidum. So you can see the sulci over here, all through. So let me clear that up. So it's supposed to be black, right? Because CSF is darker than gray and white matter. But in this case, the sulci appears white. So this is a classic picture of a subarachnoid hemorrhage. So you can see the blood which is in the subarachnoid space. It is tracking into the sulci. So this is just a small deviation, so you can tie in anatomy to this particular pathology. So whenever there is a subarachnoid hemorrhage, remember all the CSF spaces that you know of. You have the subarachnoid space between the sulci, in the interhemispheric fissure, within the ventricles and the basal system. Whenever there is a subarachnoid hemorrhage, you will see blood in at least one of these structures. The subarachnoid hemorrhage is the easiest to identify, and it usually occurs secondary to a aneurysm rupture. central nervous system consists of two types of tissue. We have the gray matter, which are collections of densely packed cell bodies, and white matter, which are nothing but bunches of axons which carry information from and to the cell bodies. So in the brain, the cerebral cortex consists of this gray matter, while the white matter is subcortical. So we call that the subcortical white matter. So as I said earlier, the gray matter consists of densely packed cell bodies. So they're highly dense. While the white matter, on the other hand, it's principally just myelinated axons. And so axons are nothing but nerve fibers which are covered by sphingomyelin, which is a type of fat. Fat, as you guys know, compared to cell body, it's going to be less dense. So the white matter as such is less dense compared to the gray matter. So with respect to the initial paradigm we established, we know that the denser a material is in CT, the more white it appears. And so the cortical gray matter is more dense and so appears more white than the subcortical white matter. So let me just mark the transition zone here so that you can identify it. So that delineates the gray matter from the white matter. If you cannot distinctly delineate this margin, you do not know where the gray matter ends and where the white matter starts, then you're looking at a edematous brain. What is striking about this image is that the moment you set eyes on it, you can say that there is no clear distinction between gray and white matter, like we saw in the previous image. So this is definitely a pathology. It does not happen normally, and in this particular case, it's because of a generalized cerebral edema. So deviating from topic a bit, can you guys see this white, highly dense structure? What do you think it could possibly be? Well, it's not a pathology. You should know that as we age, there are some degenerative changes which happen in the brain. And one of that is that certain structures in the brain undergo calcification. This is a totally normal process. So in this particular case, it happens to be the choroid plexus. Now, an important distinction one must make when viewing imaging of the brain is the identification of the central sulcus. The central sulcus, as you guys know, helps partition the frontal lobe from the parietal lobe, the precentral gyrus, which is the motor cortex, from the postcentral gyrus, the part of the parietal lobe to which all sensory information is relayed. Now, this brings back a lot of memories. Identifying a central sulcus was something which was next to impossible as an amateur back in first year. Still is now if I was true to myself. That thing's just pure evil. But nonetheless, if finding the central sulcus was hard enough on the cadaver, it's almost next to impossible for amateurs like us on CT or any other imaging modality. But because there are several signs out there, not all central sulci are the same, and most radiologists employ several signs which they utilize to identify a central sulcus, but let's not dig deep into that. So I will give you two signs which I feel is quite simple to understand and will help you reliably identify the central sulcus in most situations. So one is that in the coronal plane, that is this transverse plane over here, the central sulcus is the longest. So that's this one over here. So if you can't see that, let me just use a brighter color. Yes, so that is the central sulcus. So let me get rid of that. Another sign is called as the upper T sign. So first we have the superior frontal gyrus over here. Superior frontal gyrus is easy to identify. Just identify the longitudinal fissure and the first gyrus you see, just lateral to that on either side, is the superior frontal gyrus. And then we already know the precentral gyrus. So the superior frontal gyrus and precentral gyrus intersect forming a T, like so. So the sulcus immediately posterior to this is the central sulcus. That's it. So just use these two signs. The central sulcus is the longest in the coronal plane, and also the upper T sign, in which the superior frontal gyrus and precentral gyrus intersect to form a T, and the sulcus immediately behind this is the central sulcus. Now, we will identify the central sulcus in this particular section, but before we go into that, so I think what you would realize the moment you see this image is that the brain looks kind of funky. It looks smaller, it looks narrower, it looks thinner. So this is because this particular section is probably from an older adult, and as you age, your brain volume tends to reduce. And also, as a result of that, the ventricular system in the brain appears to become larger. So this is a normal degenerative process, so don't be alarmed by this. Let's employ the two signs that we learned to identify the central sulcus. So this is the coronal plane, and this is the longest sulcus in the coronal plane. So that is possibly the central sulcus. So let's get rid of that. Now, the upper T sign, it says that the superior frontal gyrus and the precentral gyrus intersect in a T. So first, to identify the superior frontal gyrus. So this is the median longitudinal fissure, which means these two structures are the superior frontal gyri. Let me just outline that quickly. So this intersects with this, the precentral gyrus. So let me just shade that. So this is the precentral gyrus. So this is the precentral gyrus on this side. So that forms this nice T. And so this is the, let me switch colors. This is the central sulcus. So let me get rid of all that and draw it once again so you can visualize it better. So this is the T. And right behind that, this is the central sulcus. This section clearly depicts one particular portion of the brain which you don't usually see in cadaveric anatomy. That is the insular cortex. So you have the frontal, the parietal, the occipital and temporal lobes, but you also have this additional hidden lobe called the insular lobe. So this particular portion of the cerebral cortex lies immediately beneath the sylvian fissure, and the Tyrian region of the skull overlies this region. So this insular cortex is important in the setting of a MCA infarct. That's an infarct involving the middle cerebral artery territory. So in CT, you usually do not see any significant changes in the brain parenchyma in the setting of an infarction for quite some time. But in the setting of an MCA infarct, a suspected MCA infarct, you can rely on two signs, one being the insular ribbon sign and the other is the dense MCA sign. We'll talk about the former right now. So this is the insular cortex, and just like the rest of the cerebral cortex, it consists of gyri and sulci. So it forms this kind of wavy pattern. So we call this the insular ribbon. So in the setting of an MCA infarct, what would happen is that the MCA also supplies this insular cortex area. This wavy ribbony pattern, the insular ribbon, becomes flattened, it becomes mushy. So it would be smooth like this. So that's one important radiological feature to diagnose an MCA infarct quite early. We'll definitely go into it deeper later on. Right, so the last of the gray matter structures we're going to look at are the basal ganglia and the thalamus. I always use the lateral ventricles to identify these structures because they're right up against it. So as we saw earlier, this is the lateral ventricle, one on either side. And if you notice closely, we have all this subcortical white matter which was less dense, right? So we already saw that. So this is the white matter structures. So all through that you have radiating fibers, but this particular portion right up is sandwiched between the lateral ventricle and the subcortical white matter. So if I clear all that, you can have a better look at that. Yes, so that is the caudate nucleus. Right. Next, just behind and lateral to that, over here, this is the lentiform nucleus. So let me clear that. That's the lentiform nucleus. And here we have the third ventricle, dead center. And on either side are the thalamic nuclei. Right, so if I clear all that, you can have a better look. So there is the thalamus. Right, so any insults to these structures can cause anomalies like, for example, a basal ganglia anomaly can cause extrapyramidal symptoms, while insults to the thalamus may cause a thalamic pain syndrome. Okay, so speaking of subcortical white matter, we're going to talk about two important white matter structures. One is the internal capsule and two is the corpus callosum. The internal capsule, it is, think of it as a highway which relays information from the rest of the body to the cerebral cortex and back. So all these axons from all over the body are highly condensed in the region of the internal capsule. Let's look at that first. So we already saw the caudate nucleus, the lentiform nucleus, and the thalamus. So the internal capsule kind of zigzags between these three structures. So it's right here on either side. So this huge bunch is the internal capsule. Right. So the internal capsule has three parts: the anterior limb, the genu, and the posterior limb. So over to the left side, we can differentiate the structure. So this is the anterior limb, right? And here is the genu region. And back here is the posterior limb. So the entirety of this region is supplied by the perforating branch of middle cerebral artery. So any insult to the MCA vessel, the main stem, or the perforating vessels feeding the internal capsule, will cause a profound impact on the motor and sensory function because, as I said earlier, it's kind of really bunched up over here. Okay, so moving on to corpus callosum. Firstly, let me apologize for the bad resolution because this is the only usable image I could find without being chased by the copyright monster. Right, so the corpus callosum is this beautiful dome-like structure over here. It's easily my most favorite structure in the brain. So the anterior end is the genu and the posterior end is the splenium. Right, so the corpus callosum is important in that it is the only connection between the left and right hemispheres. So this is important in the setting of either a glioma or a metastatic tumor to the brain. It is vital that you look at this area because tumors from one side of the hemisphere usually pass over to the opposing side through this corpus callosum. Elsewhere, the falx cerebri acts as a relative barrier to the spread. So this is comparable to the non-villous fascia in the pelvis, if you remember from anatomy. So the non-villous fascia prevents the fast spread of a prostatic carcinoma to the vertebral plexus. It's not that it prevents it completely. It's not a robust physical barrier, but it delays the progression of the prosthetic carcinoma. So it's something similar to that. Right, so into the posterior fossa structures, we have the brainstem and the cerebellum, the brainstem in front, and particularly in this region we have the pons. And back here we have the cerebellum. So always remember that CT does not give you a high definition of soft tissue structures. So if it is the brainstem or the cerebellum, it's always MRI, MRI, MRI. Alright, so let's talk cerebrovascular territories. So we have many vessels feeding the brain. The cerebral vessels include the anterior, middle, and posterior cerebral vessels. And in addition, we also have the vertebrobasilar system, which supplies the brainstem and also forms an anastomosis with the carotid system. So we are going to look at cerebrovascular territories at three levels. One is above the lateral ventricles. One is at the level of the insula. And the last would be at the level of the cerebellum. Right, so first we're going to talk about the region above the lateral ventricle. So think of it this way. We have the interhemispheric fissure and thin bands of the cerebral hemisphere right next to the intercerebral hemisphere is supplied by the anterior cerebral artery. So I usually think of it like a guy wearing pants with boots, like this. So the pants represent the anterior cerebral artery area. The boots themselves, they represent the posterior cerebral artery region, and the rest of the brain, whatever you see, is supplied by the middle cerebral artery. Next, we're going to look at the level of the insula. Here, this particular section, how I look at it is the poles, the anterior cerebral artery and posterior cerebral artery regions. They are kind of this heart-shaped territories on either end, so something like that. This kind of reminds me of those Rorschach pictures which they use in psychiatry, where they have these ink blots which form these symmetrical patterns, and each person perceives it differently. So this is kind of reminds me of that. So at the anterior end, that would be the anterior cerebral artery area, and back here would be the PCA region, and the rest of it is MCA. So another thing which you need to remember is that this particular region at the center, this kind of butterfly shape, it's almost exactly like the thyroid gland. So that region is supplied by the perforating branches of the middle cerebral artery. Finally, we are at the level of the cerebellum. Now, the entirety of the cerebellum is supplied by the vertebrobasilar system, and just as we saw in the section above the lateral ventricle, we have thin bands of the frontal lobe which are supplied by the anterior cerebral artery. They kind of remind me of strips of bacon. And finally, in the middle cranial fossa, we have the temporal lobe. Now, these small portions of the temporal lobe on either side, so this side over here and this side over here, they are also supplied by the posterior cerebral artery. Now, and the rest of the brain is by the middle cerebral artery. We will conclude this tutorial with a discussion on calcified structures. So if you remember from, I had said earlier that the choroid plexus undergoes calcification with age. It is important that you know what structures undergo this degenerative process, given that they might be mistaken for, say, intracerebral hemorrhage. So we already saw the choroid plexus. You can see bits of it over here within the posterior horn of the lateral ventricle, mild calcifications. And dead center, right behind the third ventricle, is this midline calcified structure. So this is the pineal gland. The pineal gland also does undergo calcification, and also, if you notice here, the forx appears kind of white. So the forx is another structure which undergoes calcification. Right, so this is a splendid image depicting the evident calcification of the fox cerebri. So in the midline, we have this dense white structure which can easily be mistaken for an intracerebral hemorrhage. So this here again, the brain and bone window paradigm plays an important role. So this same structure in bone window would appear something like this. So it's quite evident that it's some form of calcification because blood is not this dense in a bone window. Right. So this image depicts another commonly calcified structure in adults, which is the basal ganglia. So we have the basal ganglia on either side over here, which appear calcific. That concludes the anatomy section of this tutorial. I would like to take this moment to thank all of you for the overwhelming support, and we will be continuing with pathology in upcoming videos.
That's all, folks.